Our tablet supports telemedicine and telemonitoring. Many of the individuals that we work with have never, ever used any type of technology before. We have not had members who've said this is too hard to do. Why do we do it in a member's home versus making you come to a clinic is 99% of what happens to somebody happens in their home environment. It has been amazing to see our results. They've even exceeded our own expectations. I'm Susan Courts. I'm the CEO and founder of Catalytic Health Partners. I founded Catalytic Health Partners with an idea that population health management really was a huge opportunity to totally change healthcare delivery in the United States. That it is about your social scenario, so your social situation, behavioral health, and then your physical health, and we actually address them in that order. Our population mostly is chronic disease, so many of them have multiple chronic diseases. We'll also have some acute illness individuals, but most of them have some lingering issue that's likely to become chronic in nature. We have a team of individuals who work in our members' homes. They're made up of nurse practitioners, behavioral health counselors, nurses, social workers, medical assistants, and then care coordinators. Healthcare has, in my opinion, devolved to this more transactional based, how fast can we see someone? And the reality is I'm trying to get you to do things that are really difficult to do, change your lifestyle, and many times to manage these illnesses to achieve their personal goals. So we engage with Life365 because the reality is in the connected world that there are tons and tons of devices and you need to be able to interface with a number of them, not just one brand, and then you're creating all these interfaces, which is a very, very complex scenario. We simply use a device that meets our needs. It's connected to the platform and we receive the data into our systems all behind the scenes seamlessly. There is no work on our part to do anything. We already had our tablets in our platform established. We established that early on in our business. So they were able to fit right in to exactly what we already had in place, fit into our own data flow, as well as our own work stream with our members. So it was actually very seamless. Easy to use not only for our team, which was important, so that we weren't trying to spend a lot of resources in training our team, but likewise in with our members.
Technology helps us greatly in our work because there are eyes and ears where we can be in every home. So basically we have monitors in their homes to check vitals, which we have a registered nurse that reviews them on a daily basis. Plus we have tablets where we can communicate with the members and carry visits through them as well.
That's very rewarding for me to be able to get to that level in their comfort zone, not my comfort zone, which was a clinic with 4 walls and an exam table.
Our members have found not only the tablet but the devices to be very simple to use, very easy for them to show the physicians when they go to their other providers what their readings are in the tablet so that they have the continuous information.
Through that tablet, I'm able to see them virtually per se. If they don't feel well, the girls in the office will schedule them a visit with me. I'm at home connected to my system. They're in their home, in their comfort area, in their comfort zone, connected to their system. We connect the tablet, we can see each other and do what we call telemed visits. I get to see the trends in their numbers, whether it be blood pressure, their oximetry, or their blood glucose levels. It's a tool that has helped me a lot as far as having better access, easier access, quicker access to the members.
And I've been having strokes every other couple years ever since 2012. So I had a total of 5 strokes and 2 brain aneurysms. Working with Catalytic Health Partners made me feel more responsible for what I have to do. It lets me keep up with what was going on with my health. I use the tablet to take to my doctor to tell them what medication and what has happened to me because I don't remember all my medications. It helps keep a record of what's going on. The blood pressure cuff and the tablet are very easy to use.
Most rewarding for me is actually seeing and helping these people who are high cost, high risk, who normally may not be able to get the one-on-one attention that they get with us, and giving them hope.
Focusing on member goals and what they personally want to do in life, and being able to bring all the technology to bear, not only have we had improved member outcomes from a personal perspective in their personal lives, their health has been tremendously improved. Our readmission rate is a fraction of what it was when we first took on the population, but likewise the utilization of the emergency room is greatly declined, as well as acute care hospital utilization. So I think the health plan would say the same thing as we say, like nobody expected it would be this dramatic this quickly.